Hello everyone, and welcome back to CHS Relax, a channel where comfort meets clinical care. I'm Dr. Nathan, an ENT specialist, and today, you'll be joining me for a special ear cleaning session with one of my regular patients. This case involves a mild ear infection, and I'll be walking you through the full cleaning process step by step. Our patient today came in complaining of mild ear pain, itchiness, and reduced hearing in the left ear. These are typical symptoms of an outer ear infection, medically known as otitis externa. Upon initial examination, I also noticed some inflammation in the ear canal and a significant buildup of wax and debris, which has likely trapped moisture and contributed to the infection. Now before we start the actual cleaning, it's important to remember that not all earwax is bad. In fact, it's your body's natural defense mechanism. But when wax accumulates excessively, or when people try to clean their ears improperly, like using cotton swabs, it can push wax deeper inside, blocking the canal and creating a breeding ground for bacteria. To begin the procedure, I gently insert a video otoscope into the ear canal so both you and I can get a clear look inside. As you can see on screen, the ear canal is quite congested with compacted wax, along with some signs of infection, slight redness, and even a few small flakes of skin, which could be early signs of irritation or fungal growth. The first step in the cleaning process is softening the wax. I'll apply a few drops of a sterile, warm saline solution. This helps break down the hardened wax, making it easier and safer to remove without causing any trauma to the delicate skin of the ear canal. After allowing the solution to sit for a minute or two, I'll begin the gentle extraction. For this, I'm using a microsuction device, a small, precise instrument that safely vacuums out the loosened wax without touching the sensitive canal walls. This method is far more effective and less invasive than traditional ear syringing. As I remove the wax, you may hear some subtle sounds from the suction. That's completely normal. In fact, many patients find it relaxing, almost like a mini ASMR session in a medical setting. At this stage, the wax coming out is a mixture of old, dry cerumen and some moist debris likely trapped due to the infection. Once the major blockages are cleared, I proceed more delicately. I switch to a fine curette tool to manually remove any remaining wax near the edges of the canal. I also clean out any residual skin flakes and discharge that may have collected. This step is slow and detailed because we're working close to the eardrum. As I reach the deeper part of the canal, you can now clearly see the tympanic membrane, or eardrum. It looks slightly inflamed but intact, which is a good sign. No perforation, no fluid buildup behind the drum, so the infection seems limited to the outer ear. To help soothe the inflamed tissue and prevent further bacterial growth, I'll now apply a medicated antibacterial drop, specially formulated for external ear infections. This will relieve discomfort, reduce inflammation, and accelerate healing over the next few days. Now that the cleaning is complete, I'll offer the patient some simple aftercare advice. Avoid water entering the ear for at least 48 hours, especially during showers. No cotton swabs, no scratching, and definitely no inserting foreign objects into the ear canal. I also recommend a follow-up visit in about a week, just to make sure the infection has fully cleared and that the ear canal remains clean and healthy. If symptoms return or worsen, further examination may be necessary to rule out other causes like fungal otitis or middle ear infections. So, that's it for today's session. I hope you found this journey informative and a bit relaxing, too. Ear cleaning isn't just about hygiene, it's about comfort, clarity, and good health. If you ever feel discomfort in your ears, don't try to handle it yourself. Always consult a qualified professional. Thank you for joining me here on CHS Relax. If you enjoyed this video and want to see more real-time procedures and educational content, don't forget to like, subscribe, and click the notification bell so you never miss an update. Until next time, stay safe, stay curious, and take good care of your ears.